I'm a urologist and pelvic surgeon, and today we're going to talk about men's health. And this could be your first symptom of an enlarged prostate. So, an enlarged prostate is very common. It affects about 70% of men over the age of 60. However, only 15 to 20% of those men actually have symptoms. And in fact, they have what's called lower urinary tract symptoms related to that enlarged prostate. But oftentimes people can have an enlarged prostate without really any symptoms at all. But if you're noticing any of these symptoms, this could be your first symptom that you have an enlarged prostate. The first one is you might have trouble emptying your bladder completely. So you might find that after you urinate, you still have some urine left over in your bladder, or you have a weak stream. These are both signs that your urine flow is not normal and could be due to an enlarged prostate. No, 2 is straining during urination. So when you have an enlarged prostate, it kind of acts like a dam in the tube that urine flows through, the urethra. And so you have to kind of squeeze out that urine because it's not flowing normally. And sometimes people will describe that as like having to push or strain in order to empty your bladder. No. 3 is a change in urine. So you may notice that your urine stream is a bit more of a spray. It's not a straight stream. And sometimes it can even be a bit more of like a forked stream. All of these things are signs of an enlarged prostate that are concerning and should make you see your doctor. The 4th sign is waking up at night to urinate more than 1 time. So typically, we find that most people will wake up 1 time at night to urinate. Sometimes if you drink a lot before bed, you might get up 2 times. But if you're getting up more than that, say 3 or 4 times a night, this could be a sign of an enlarged prostate. And lastly, having a hesitancy when you start the stream. So sometimes it can be a bit difficult to start that stream of urine. You press the button in the bathroom and nothing comes out, or it has a very slow start and then it eventually picks up. That can also be a sign of an enlarged prostate. Now, an important thing to note here is that these are all very non-specific symptoms. They could be due to other things as well. So it's really important to see your doctor. Make sure that you get checked out. Make sure there's no other causes for these symptoms. In order to diagnose an enlarged prostate, your doctor will do a digital rectal exam. So they stick a finger into your rectum and feel around the prostate to see if it has enlarged. And sometimes, they'll do a prostate-specific antigen test to check for levels of that in the blood, which can also sometimes be elevated if you have an enlarged prostate. And lastly, we might do a bladder scan. A bladder scan is a simple test where we just ask you to urinate into a toilet that has a special device in it. And it measures how much urine is left over in your bladder after you urinate. If you're diagnosed with an enlarged prostate, there is a number of treatments that we can offer you, from medications to minimally invasive procedures to surgery. Depending on what your symptoms are and how severe they are, your doctor will help determine what the best treatment options are for you. I hope this was helpful. If you enjoyed this content, please make sure to share it with your friends and subscribe down below. As always, remember to take care of yourself because you're worth it.